Hello, everyone. I'm really delighted to have this opportunity to have my friend and colleague, Dr. Ilene Serlin, to be here at our Beijing Center for Training and Education, here to record this lecture on body movement, on embodiment, whole person care, as part of our curriculum in Humanistic Psychology. During the recording, I'm going to be sitting by Ilene here, and then may have some questions to prompt the dialogue. And then afterwards, we'll also have a chance for some of the students also who are here to ask Ilene some questions as well. So we hope that this interactive type of a dialogue will be more enriching for you. So with that, I'm going to give the floor over to Ilene and have Ilene talk to us first a little bit about what is whole person care within the realm of humanistic psychology.
Thank you, Dr. Yang, for your introduction, and I celebrate the opening of your new center here. It's very exciting to be part of it, and I am honored to be part of it. Thank you. And I understand that I bring a certain perspective here that may not be so obvious in other forms of psychology, so I'll speak to it. And the irony is, in China, whole person care is very traditional. It's really, I think you think of the whole person as the mind and body and speech and actions. The United States, there's long history in Western philosophy and psychology that the mind and the body have been separated. From Descartes, the French philosopher, on, so that we've had to work, many of us in the United States, to try to bring them back together. So actually it's rather new in the United States. And humanistic psychology has been one of the pioneers in doing that. Much of psychology, we see Freud, above us right here, has focused on dreams, thoughts, fantasies, but it's all in the mind, and the mind is considered to be the brain and the mind. Whereas now we know that actually we have the brain and the mind goes through the whole body, that the body can sense, the body knows, the body feels, the body reacts. We have learned that there's more what they call synapses in the stomach. We have an expression in the United States, a gut feeling that this person is dangerous or this person can be trusted. But we've learned a lot in the Western world to not listen to this, and we're not trained to listen to it, and we think that what we think is always true. And in fact, Descartes said, I think, therefore I am, as though my life is my thoughts. Whereas I think here, you know, in the East and in many other parts of the world, that number one, we are bigger than our thoughts. We are our hearts, we are our souls, and we are connected to other people. So it's not just my thoughts, but my thoughts resonate with other people. We are interconnected, we are all connected, we are connected to life around us. In the United States, we still have many compartments. We have eco-psychology that deals with the natural world around us. We have somatic psychology that focuses on the body. But I think humanistic psychology has been very important in trying to keep it all together, that we are a person who has thoughts, who has feelings, who lives in a world, in a whole setting of relationships with other people, in the natural world, affected by the seasons, affected by the environment, and you can't separate it all. So that's really whole person approach. Also our social world, we are affected by whether we have money, whether we have enough to eat. All of that affects our emotions, our state of mind. So again, it's not just our thoughts. And psychology, if it focuses on just the thoughts, is really missing the bigger picture. So whole person is really the whole person. When we focus on somatic approaches, that means really the body. Soma is Greek for body. And the Greeks actually were very important in bringing soma and somatic into their study of medicine, and they didn't have psychology, but they did have theories in the world that we were affected by certain organs of the body, certain fluids in the body affected our emotions. So that actually has gotten lost. Some of the pioneers of humanistic psychology, and we can name a couple here. We've sent Tom Hanna, Wilhelm Reich, Alexander Lowen. These were all pioneers of somatic psychology, saying that by what we mean by somatic psychology is that the body is not just matter. We have matter, we have air, we have fluid. The body has fluids. The body, we know from women, the body has seasons once a month, like the moon. The body, it changes emotions. We also have in the body, we keep memories in the body. So what some of the early somatic psychologists did, for example, if you do a massage, suddenly somebody will remember something. Sometimes it's a trauma. Sometimes they'll start crying. But this is a release. This is a very important part because our mind and our intellect often has defenses. It does not want to look. I'll speak for a minute about trauma, which is very dramatic. But if something terrible happens when we're young, if we want to deal with it, we often will block it. We don't remember it. We can't access it later. If we talk to somebody about what happened, we just have a blank. But if you're touched in a certain way, suddenly it comes back. So memories, emotions are in the body. And what these early pioneers did is they invented a series of exercises, physical exercises, where you put your body in certain positions, you lean backward, and it will release energy. Again, you have a long tradition of martial arts and embodied therapies that do this. But from the point of view of psychology, we focus on the emotions and the memories, not so much on correct posture or anything like that. We use the body as a vehicle, as a way. The body is also very important we're going to talk about dance therapy, but nonverbal communication is something that we've studied in humanistic psychology, so that the body is always expressing things. Let me go back a minute. I think you've heard about Carl Rogers talks about congruence, that one of the goals of humanistic psychology is to be congruent. What does that mean? From the point of view of the body, it means that what you say, what you express with your words, what you express with your body, what other people sense with your emotions, with the energy from you, are all aligned. Because very often people will come to my office, they say one thing, their body communicates something else, like, hello, I love you, right? And we say there's something off here, it doesn't line up. And people are often not aware that they're giving mixed messages. Or they come in saying, I don't know why, but I feel at the workplace people avoid me, they stay away, but I must be doing something or sending messages or something but I don't know what I'm doing. Help me reflect on what, let's say, my body is expressing, that my words are not. So people actually really want to know, how do other people experience them? And a lot of that is in the body. The way we walk in a room, the way we shake hands or don't shake hands, or try to hide, or try to be welcoming or gracious, all of that is in the body. So nonverbal communication is actually a very systematic way of studying what the body is saying. And then what we do in communication is we say, what are the words saying? What is the body expressing? Each are like music, a different line. And then we look, are they all in harmony or are they in conflict? And we reflect back to people. So they get a better sense of their control. And they can choose to stay in conflict or they can choose to make some changes. So we're not trying to prescribe behavior, we're trying to give people more choice, with more information about how they move through the world. And again, that information is not a thought, it's experience. And that's another broad theme of humanistic psychology. It's about, we've talked about here and now, that's one of the themes. It's about experience in the world. So perhaps I experience you as staying away, or as inviting me to come closer. And if I share that with you, then you understand how I experience you, and you can be more conscious of how you are in relationships. So it's very important in relationships. And again, if we say let's design, and the way we teach or work with clients is we don't just say, you came in the room really fast and I felt stressed when you came in the room. We'll just say something like, try to come in the room fast. Now walk slowly. Can you feel the difference? I often will work with polarities or opposites. So somebody's very fast all the time, and I'm very stressed with them. And as a therapist, I use myself as the instrument. I may say, whew, that's so fast. We need some slowness here. We need some balance. So I might introduce fast, very fast, then I might introduce very slow. And then you might have somebody start slow, get faster and faster and faster, and then slow, 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 and slower, slower, and faster and faster, so they can feel and modulate and get a sense of themselves. And again, we don't tell them, you're not in balance, you must be in balance. We don't prescribe. We give people choices and through experience of how they are in the world and how they live. So I had a client who I was waiting for her, and she came running in the room, and of course the story she told me was about a lot of stress in her family, in the workplace, but I felt it as soon as she walked in the room. So also important as therapist training that we train ourselves in the system so that our sensitivity to this dimension of life is something we use to make hypotheses about someone's behavior. We tend not to use diagnoses in behavior. I wouldn't say manic personality based on that, but I would say probably overbalanced in the fast realm, perhaps needs more balance in the slow, and then I would test it and try it and work with somebody to see where is the balance and how do you feel and so forth. So again, they are the expert in themselves, but we call it expand the repertoire so they have more choices. And freedom is a big part of humanistic psychology, and we feel that people can't really be free if they're stuck in only one dimension. I work a lot with, let's say I was born in New York and people tend on the sidewalk, it's very crowded, to work in what we call the sagittal plane, just forward and backward. And then I moved to Texas, which has big open spaces, and suddenly you see people's bodies change and their worldview changes. They get more expansive, not just in the thinking, but in how they carry themselves in the world. So we work with space a lot too. I was describing an example of, they use this in the British school system, thinking of agility. Somebody who can, if you say think fast, that doesn't mean much, but if you say walk, 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 turn, walk, 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 turn, walk, 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 turn, you have to be spontaneous, you have to be in the moment to do that. And if you're thinking too much, you bump into things. But if you have all your senses with you, we do exercise, can you sense somebody behind you approaching? Pretend you have eyes, because actually we have what they call proprioceptive cells. We have cells all over the body that can sense if somebody's coming from here or here, but we think, and our life is often focused on goals, on what's straight ahead. So we have an expression, smell the roses, or stop, or be indirect. But again, if you're trained, as most of us are in school, pass exams, have goals, you tend to be like this in the world. And it doesn't mean much to someone to say, relax, open up, explore the world. But if they suddenly get the feeling, they go there, they go there, they go, oh, there's something there. Suddenly, horizons open. And again, they have more choice and more freedom. I think there's some questions about dance versus somatic. I know that's confusing. It's actually confusing in the United States too. Somatic psychology is almost a separate. You can get a master's degree in somatic psychology. It makes me a little bit nervous because it's almost like, well, you have the mind, now you have the focus on the body again. And from my perspective, you lose the whole person. So I like to integrate them all. Dance therapy I'll tell my story. I started as a folk dancer. I always danced, and I loved to travel in different countries and learn the dances, and to me that was the best way to make relationships with people. You share your songs, you share your dances. On this trip I learned some dances and saw some dances in Tibet and Bhutan and Chinese traditional dances. You learn a lot about the culture. And I was actually part of research projects, Columbia University, where you analyze the dances, say something about the complexity of the culture. If it's agricultural, a lot of folk dance comes from putting seeds in the ground. And some of the dances we saw in the Tibet, they do the same thing. You either make circles or you have lines, and folk dances in America have that. So dance therapists felt that dance was, I want to say again about humanistic, that we focus on culture. That obviously human beings are different in different cultures, and we're all affected by our cultures. And to understand a person, it's important to understand the culture they come from. So in dance, you focus on dance as a way that human expression has been for thousands of years. People expressed weddings and sad dances for funerals, and in the United States people used to build houses together. It was a way that people, and I've seen in my travels even here through Tibet, Bhutan, people singing while they were working, and the women were making walls for houses, pounding earth and singing. And a lot of dance comes from what they call stylized work. Dance really celebrates everyday activities, whether it's making bread, or putting seeds in the ground, or picking from the harvest. And so they were harvest dances and things like that. And that used to connect human beings to nature and the seasons, and we have lost so much of that. A lot of psychology, I keep looking at Freud above there. Modern psychology, modern Western psychology, was invented a lot for men who lived in cities and were well educated. They could speak, they had enough food. They didn't necessarily care what season it was or how the harvest grew. But many of the people we see in our offices today, and I'm going to say this about globalization, are disconnected from nature and the natural world, especially with technology. So in dance, we actually feel the ground. It's amazing how sometimes people come into the office and it's as though they're walking about this high off the ground. And you can see their feet are not really making connection with the earth. And so we do things like African dancing, where your weight is very low, and you lower your center of gravity, so that, and I had to, because I tend to be somewhat of a thinking type, and I spent many years learning to use my weight in this way. And so in dance you really analyze. A thinking type center of gravity tends to be somewhat high when they walk, and tend to live and be, and I love traveling, I love moving through space, and I had to get local and down, and I used a lot of dance to bring my focus down and to the present moment. And we talk about, and we do a lot with grounding ourselves, literally, and I'll start sessions with literally feel your feet on the ground. It's really that simple. It's both basic, simple, and also symbolic. Because getting grounded, feeling your feet on the ground, translates symbolically into the world. It's, are you practical? Can you make decisions? Are your feet on the ground? Or are you what we call a Luftmensch? You love to think. And I had a joke with my colleague that we used to come out of a meeting. We couldn't find where our car was parked because we were so busy talking and thinking. We would forget where we put our car. So it's about being in the present moment and using your weight. This is even Freud said, the ego is a body ego. So it's about bringing it into the body, but dance gave a format through culture and history that communicated happy times, sad. It gave people in the so the community is another thing that I think that's gotten lost in modern psychology. It's often individual in an office talking. And we've really lost our connection to other people. So when I used to work with cancer patients, for example, there was an enormous sense of loneliness because when they got this terrible disease, people get tired of hearing you talk about it, but to you it's the most important thing. My next visit to the doctor, is it coming back, the tumor? Should I plan my funeral? Should I plan to go back to work? You don't know, and it's with you all the time. And so we would do dances where, like in the old days, people would like make bread together, the women would sew together, and you're back in a community. It's rhythm that connects people. And we've lost so much of the rhythm of life that, especially with technology, things are linear. Or in the Western world, music is 1, 2, 3, 1, 2, 3, 1, 2, 3. In Greece and the Balkans, it's a very different kind of rhythm. So to understand life through rhythm is something that in the old days they used to play the drums to communicate to each other. Even now when a client comes into the office, I listen to the rhythm of the speech. So when I listen to words, I don't just listen to the meaning of the words. Some people not only talk very fast, but there's no space between the words. They don't pause. They don't pause and wait for other people to respond. And often we talk at people. Laura Pearls in that tape said that was her teacher Martin Buber. He didn't talk at you, he talked with you. That's dialogue. You say something and then you wait for an answer. And then you say something back, and then you wait for an answer, and there's a natural rhythm and flow to conversation. So a lot of the sort of the diagnoses, or when people are off, is they're off in rhythm. And extreme examples, when I worked in psychiatric hospitals with patients with schizophrenia, it was a very strange experience. You might be talking to somebody in the middle of a conversation, they might just come in, and then suddenly leave. We have an expression, marching to a different drummer. So you can be unique. You can hear your own rhythm. Maybe everybody around you says you should conform, you should be an engineer, you should be a good son, you should be, and you're hearing a different rhythm. In many ways, that's a very healthy thing, that you find your own rhythm in life. But sometimes if it's extreme, you're really out of connection with family and with people, and your rhythm is just off. And again, you may not understand. I don't know why people keep rejecting me. But if we, and I did an improvisation once with someone who was very obedient, always followed rules. And so I played music that was like this, and I had this person dance around the beat, not just bum, bum, but like bum, 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 and play with the music and find ways to dance with it and interact with it instead of staying always on the lines. We think outside the box. So if you're always in a box and you're always following a box, you don't know how to get outside the box. So again, we make experiential exercises that take a problem or an issue and make an experience to explore it. And again, not to tell people what to do, but to give them more tools so they can understand themselves and their relationships better to the world. So where dance comes from is it has a whole tradition of dances, and I've studied some shamanic dance. So for example, that's where you're working with powerful energy. And in that sense, I will use a circle. The teachers of my teachers in dance therapy worked in psychiatric hospital where people are very disorganized and there's a lot of chaos. So even to have people form a circle was already an accomplishment. And so I learned, and I was kind of trained to work in a circle. And then a circle is both a very universal, timeless symbol. In a circle, everybody can make eye contact, everybody's kind of equal. It's a kind of what they call equal leadership style, where I'm not sitting taller than everybody, but we're all on the same level. And we will all often start with a warm-up where everybody gets a chance to lead, so that it puts us in the same place. And again, it's creating a community. And so I really like the circle. The more I've understood about, if you look at art forms and you look at the way the circle is, so dance is, I would say, more related to the world of art. Somatic is more related to the body. And that would kind of be the difference. Each one has its own associations. So if I get certified in somatic therapy, that's very different than if I go through the Dance Therapy Association. If I go through the dance therapy, I have to be trained in different languages of dance. I need to learn Indian dance and African dance and different, because each one is a language. And each one opens a culture. I worked with African American adolescents at first, and I really had to learn more African dancing in order to connect with them. So we study all of these in both. I think we study the body, the kinesiology, how the joints work, how the body works. But again, I would say somatic psychology really focuses on the body, and dance focuses on culture and art and the symbols that dance expresses, like mandalas, like wholeness comes from a mandala in the circle.
You know, one phrase, very short phrase that you talked about stayed with me a long time, and it's convicting actually. You said the body does not lie.
Yeah.
Could you say more about that? Maybe give some examples?
Yeah. I think, well, let me contradict you at first.
Okay.
I've worked with trained ballerinas, let's say, trained dancers. In that case, the body does lie, because they've been trained to portray a certain, let's say, loveliness when actually they're really angry. But I can train myself to look graceful and beautiful, you see.
Okay.
So it's even more complicated. The body doesn't lie unless it's lying, unless you have special training. But for the most part, since most of us are not trained to develop our bodies, and we're much more trained to develop our thinking and our spoken, the body's actually expressing what's more real. Yeah. So I may say, it's kind of the example I gave, like, how nice to meet you, and really my body is sort of showing something very different.
Yeah. Or my own example is, I want to like you, but my body just won't let me go there for some reason.
Right.
Or maybe maybe not. I am lying there.
Yes.
But my body is more true, so that's,
well,
perhaps not.
Let me suggest a different word.
Okay.
Because humanistic psychology, we've had this conversation about authenticity once. And I think authenticity is not simple. I think often most of us have some conflict. So I think the expression is, I want to like you, but my body's not ready yet. Okay. That's authentic.
Okay.
Just to say, I want to like you is lying, is not really fair. Because part of me really does want to like you, and part of me really is not ready. And so to be authentic means to honor both parts, or all the parts.
That feels much better.
Yes.
And actually, I think that feels more true to where I'm at. Whereas I like that better.
Yeah. And that's generally where most of us are at, with complications, and part wants to do this and part wants to do that. And very few people are exactly just one thing.
The other question I want to ask you is to link some history, some developmental history. And in one of the interviews that you did with Rollo May, Kirk Schneider and Tom Greening was there, you asked him, this is 30 years ago, you asked him about, what about working with the body? What about nonverbal? And this is from our father, right? Rollo May. And him being trained more from an analytic perspective. Says, I respect that, but I think talk therapy, that's what it's about. So now, 30 years later, I see that the field has developed. You've been one of the pioneers, and then you bring it here to China, and it's developing here. Could you talk some about that development from Rollo May to what you've done, and now what you see the work being done here in China?
Again, it's so exciting because it's all, on the one hand, very new in China, but I think very ancient. I think you have so many traditions that already speak to this, and we have to be careful from the West not to say our psychology is the right one, that we really need to respect the traditions that you have here. Yes, you're absolutely right. Rollo May was trained as a pastor. He was trained in theology.
Oh, I didn't know that.
Religion, philosophy. So that's his comfort zone.
That's true.
Yeah. But I think that he emphasized the here and now a lot in his work. His presence was, people felt very comfortable with him. He encouraged people to open up. He certainly didn't want people to be nice. He very much respected anxiety, sort of negative emotions, giving permission for people to be not perfect, which I think is very important. But I don't think he was trained in the body at all. Now, actually looking at Freud, I think there were some well, I said Alexander Lowen and Wilhelm Reich, and some of the Wilhelm Alexander, some of the people who during this time were experimenting with, who were physicians, psychosomatic medicine. So they would say things, and I think this is true, the little bit I know of Chinese medicine. Some people say, well, we're all getting a lot of stress every day. If I have a tendency, whether it's genetic, I'll experience a heart attack. Somebody else may experience the stress as cancer, that the body symptoms are expressing something about the personality. And some of it is a lot of research since Rollo May. So again, when I worked with cancer patients, there was what they call type C personality. It was mostly women that I worked with. This is breast cancer. That type C personalities tend to say yes, have trouble saying no, and have trouble expressing anger. Whereas type A personality experience heart attacks because they're aggressive, and so they externalize the stress, and they get heart attacks. So that the personality type and how your body will express an illness are very connected. And a lot of that research was done after Rollo May.
Pioneer since.
Yes, we know a lot more about genetics in the body since then.
Then would you speak some about the work that you're doing here in China?
Mark, I have to say, Dr. Yang, that I am so grateful for what you're pioneering here, and for understanding the importance of the body, and I guess the feminine perspective.
Yes, we need to spend some time talking about that.
Yes, because again, I'm looking at men on the wall. Because, and this is true in the United States, that it's often the men who like to think abstractly and who write the books about the theories. So that, to give a direct example, as you know, my teacher therapist was Laura Perls, wife of Fritz Perls. They developed the theory together. She had a Ph.D. in psychophysics from the University of Frankfurt, studied philosophy, every bit as educated as Fritz Perls. But was left out of the books. And then his way of describing the theory became, as people now study Gestalt theory and the film of Fritz Perls and so on, so it's associated with his theater background. And she was so much more subtle and worked so differently, and so a lot of valuable theory is lost because she didn't want to write. And she was much more interested in relationships, as we've talked about. So to bring in the other half, the theory is really important, the words are really important, but you've understood that the women's voice, that women tend to be, as Laura was, much more interested in her students and their life and being with them than talking about it or writing about it. But that gets lost as students from the other generations get taught. So I feel strongly that it's important to preserve these voices in humanistic psychology, and you do here in China. So I'm teaching with you, and I'm not training dance therapists. I bring my background in dance and training in nonverbal communication. I must say that I got a master's in dance therapy, but I had to do a lot more education in psychology to really understand the power of movement And then once we move and there's something happens in the group, then to take that and really work with it psychologically and slowly. So sometimes my feeling is the expressive therapies, just expressing or catharting is enough, and then they move on to something else. And I think you really need to develop it, and that's just the beginning of the work, is once the expression gets out. So here, through your institute and through Humanistics, we're able to do the whole thing, not just stay in somatic, not just stay in training dance therapists to do dance therapy, but an integrated that has a good understanding of psychology, a good understanding of expression, a good understanding of the body expression, and then how to work from all those dimensions. It's very hard to describe what that kind of vision is. But again, I think humanistic psychology gives us the biggest umbrella to put it under. But we have to keep remembering the women's voice, the holding, the relationships, the earth, the nonverbal part too.
And I think the important part of the faculty, you being here to share your voice in our curriculum, and the perspective that you bring.
And the female students who understand it very quickly.
So let's open it up to some of the students here and see what questions they may have.
Sure. Grace asked the question about how can a dance therapist work with trauma, because the body can store trauma and very strong emotions that happen with trauma. Let me go back a little bit to say, because you and I have talked about this, that I have worked with trauma in a number of countries, the Syrian refugees and Turkey and Istanbul, not so much in China, but there is trauma in China. And just like in Israel, the first, and just like individually, the first and a healthy response to trauma is to deny it, is to focus on being strong and dealing with life and carrying on. And then, as they say with trauma, once you begin to feel safe, you can let your defenses down and start dealing with trauma. And China may be ready to start looking at some of the trauma in its history. That's what happened in Israel. It took up to the 1990s for them to say, we're not just warriors and strong, but we actually can have suffered trauma from the wars, and we have to deal with it because it doesn't get passed down to the generations. So let's say I worked with a Syrian refugee who not only was she dislocated and her family killed, and there she was in Jordan, but she was so anxious she could hardly, when she was sitting with me, she just all anxiety and fear. That wasn't the problem so much. The problem she brought to me was that she was transmitting that to her daughter. That when her children felt the fear and they were clinging to her, and because she was so strung so tightly, couldn't relax, that she would snap at them and be aggressive with them, and then would feel terrible and very, very bad about her relationship with her children. And then the children would feel that and then pass it on to their children. So we call this intergenerational effects of trauma. And you could feel it in the body. So with her, I did a lot of kind of relaxation exercises. We found some music. It was interesting. I found some music that I find relaxing. She didn't like it. But then we found other music that she... So again, it has to be individualized, subjective, and taught her just some relaxing exercises so she could center herself before, let's say, the children came back from school. So she could quiet herself and what to do. Sometimes we work with the mothers and the children together with kind of games and playing, which releases it. Play is really, really important in creativity. The children were expressing, you know, in the drawings, houses burning and things like that. But if they can draw it, they are already externalizing it. There's a witness. It's not, as they say, possessing them. We call it, in trauma work, emotions hijack you, meaning they take away your rational mind and you're out of control. And that's the worst part of emotions, that get too powerful. So you work to develop they do a lot of mindfulness and meditation. So you can actually tolerate strong emotions. And I do things with just grounding. Feel your weight in the chair, stay here, don't dissociate, don't run away. Emotions are a wave, they'll come, but they'll also go. Keep your feet on the ground. So, a bit of a flip answer to your question about how do you work with trauma is very slowly. You don't open up the trauma. You don't open up. You help people first feel strength, that they can trust that they won't shatter or break with strong emotions. Or they often use imagery about a safe place. You can come back to safe place or safe person. And then slowly you begin to approach the strong emotions and then come back to safety. So always start with safety, always move very slowly to let people really tolerate more and more stronger emotions without splitting apart. But again, that's in the body, that sense of strength, and I can stay in one piece and not fall apart. So the question, if I may repeat, was about how can the therapist improve congruence of your own mind and body so that you can work most effectively. So if, kind of from the example I gave before, if somebody's coming in saying, you say, how are you? Fine, and you're feeling something's not right. So what we say is, we train the therapist, trust yourself. First thing is trust your reality. Something's not right. So instead of saying, fine, oh, I'm glad to hear that everything's fine. Instead of believing the words, you might explore a little more. Oh, tell me more about your life, or well, what about this, or and try to find or help the person relax enough to be able to talk about what's not fine. So I think the most important thing is to learn about your own body reactions and to use those in your therapy as a guide to what's really going on in the room. That's the most important, basic.
And I think the other part of Amy's question was, well, I'm not a trained dance therapist. I don't really know much about dance. How can I incorporate some of what you're talking about? To me, mainly a talk therapist. How can I incorporate some dance, some movement into my mainly talk therapy?
Yes. I was tempted to we call it amplifying your gestures sometimes, and this would
right
be
here now.
this would be
right
Gestalt.
now.
This would be Gestalt. You would say, somebody would say, I think I have the, and say, what are your hands doing? Let your hands talk. That's a very simple thing, and Gestalt therapy does that. It's right there in front of you, so you don't have to think. You say, let your hand, what do your hands want to do? Or, my hands want to, strangle you, or my hands want to,
Wow, that was powerful. Yeah, right there.
Right there.
Demonstrate. Yes,
Right there.
Right here now. Thank you. That's
You're welcome. Let your hands speak.
Speaking, I didn't even realize. Talk about the body. And one of the things I really would like our students to understand more is embodiment, which has the body in.
Yes.
Can you talk more about embodiment?
Yes.
How did that come about? Its place in humanistic psychology? How you work with some concept of embodiment?
I'm thinking of a wonderful philosopher, and I know you want this to be practical, but I just want to say this. Maxine Sheets Johnson. Okay. A woman, she's in her 80s now, and she's written a lot about embodiment. And she's a phenomenologist, and she's a dancer. And she writes, she critiques a lot of Western male philosophy by saying they observed, she called it armchair, they observed what they understand, people. But she actually studies insects, animals, what she calls motility. And that consciousness is not just out there, consciousness is always in the body. Consciousness of something, of the self or of other people. So that's a whole philosophical question about, is consciousness just abstract or is it in the body? And she writes a wonderful critique of philosophy that it's in the body. The and Merleau-Ponty, the primacy of perception. He writes about incarnate perception. Perception, again, is incarnate. It's in the body. So basically, what that means is kind of what we were talking about, the whole body senses. To be embodied means, well, let me just say, you have I'm going to do this now, to be a person of authority, gravitas, means I have weight, means I'm speaking from here, means I'm in my body. Whereas I see a lot of people who are and they speak from up here, and they're not in their bodies, and it's a way of sort of saying, I don't much matter, or don't pay attention to me, or I'm a child, but to speak with the whole body is powerful. And so most of us don't learn how to do it. And it can be threatening, actually, to be that powerful. But to be in your body so that everything is speaking, that's embodiment. Again, that's when the expression is not just in the words or not just in the upper part, but with gravitas, with the whole body. I sometimes work with words. I do work with some women who have very high voices, and they do sometimes see themselves like dolls, like little princesses or dolls, and these are 40-year-old women who don't have much earth, and they're not really living in their body, so we might experiment with the voice, really speak from here. Acting classes do that, and singing. Some I will suggest that they take singing lessons to bring their voice down into the body, and they work with a coach that way. And the body is a resonating. And some people, they say you can hear the soul of a person in the voice, of a resonance. Some people's voices are very flat, like music that's flat. It doesn't have overtones and a warm feel to it, because the whole body is not a resonating chamber. It's just a very thin voice. So embodiment means the whole person is in the whole body. Yeah. And we pay attention to all of that in the training.
It makes me think about, earlier you talked about congruence, that not just to talk about something, but to embody it,
yes.
live it out, ground it in. It also makes me think of embodiment and congruence.
Absolutely, yeah.
Earlier you talked about an important place for creativity in the work.
Ah, yeah.
Could you say some more about that?
Yeah. I'm trying to remember where it was connected to in the conversation we had about creativity. Do you remember where the question came from?
It came towards the end when you were talking about body, dance, movement. Before we open up the questions to students.
One of it was thinking outside the box.
That's right.
But I will say that in today's world, I think, in today's modern world, oh yes, I was explaining the example of the woman, she only could like march to the beat of the drum of the family, do this, do that, do that, do that, and then I had her try to find ways in and around it. Well, I think it's mostly important in today's world that we create our own lives. That's a big theme in humanistic psychology, by the way. Creativity is often thought of as just drawing a picture. It's not that. It's your whole life is creative. We create our lives. That's a big theme in humanism. Yes, we have givens in life. We have certain families we were born into, certain conditions, certain amount of money, certain education, but in humanistic, I think we tend to emphasize, but we have the freedom to create more and new. And people have to feel creativity or feel outside the box before they can apply that to their life. So you might do a creativity exercise with setting up certain things and have people just walk around, or even now I may say find a new way to get out of the chair. Instead of getting out this way, the normal way, I might try something else or see what else is possible. And then I say, oh, I can twist, I can go around objects, I can go around my boss at work. I don't have to do this, but I can accomplish what I want that way, or I can transfer it that way. So again, first the experience, and then the application to their lives. And again, if you tend to be very goal-oriented, you don't think that, oh, you can get the job done that way. That every moment gives possibilities, and if that's blocked, maybe you can go that way. Well, we do that in traffic all the time. We have that here. But again, if you're stuck in certain patterns, you don't see other possibilities. So first you have to feel other possibilities. People do, I don't know if you'll do this in the office, but we have simple exercises like keep 1 foot on the floor. Now find all the different ways you can move with 1 foot. Or we'll do funny exercises like one hand here and one hand here. Now what else can move? And what you're doing is this is existential theory. You're saying here, these are the limits. You have to put that hand here and you have to put that hand here. Now what else is possible? Well, I can do that. I can draw with this foot. Because we always have certain limits in life. So what else is possible? Find something new that can happen. And you open people's minds to, oh, there's always a new way or a new something. And then they apply it to everyday situations. You give them a little exercise, just a taste of something. And that's the creativity of the therapist. We're always making up little exercises you take a point or something you want to teach, and then you make up a little exercise so they can experience. And they say, now how is that part of like your life? Experience first, then concepts. So body first, then thoughts.
One of the things the synthesis that you talked about was creativity is not about the product.
Yes.
It's a process.
Yes.
That's a nice way of focus.
Yes. That's so important. And I was thinking before about one of the things, I was going to tell you about a course I'm teaching on arts-based research. And there's a whole discussion about imagery, and James Hillman talks about what's an image. It's a way of seeing. And it's the ability to see every moment as a composition, as a movie. Whether let's say you want to take a photo, you're already seeing how does that line up with that, and what's the and where's the frame, and the contrast of the colors. But if you take that into life, everything is interesting. Everything's the way they're sitting, the way the rhythm of the feet is, So what they say is an image is a way of seeing. And you could say it's of seeing beauty, but then one of the early dance therapists said, they asked her, how can you work with people who are so terrible emotions, anger and fear? And she said, I find all emotions beautiful.
That's nice.
And so it's not beauty as in pretty. It's in beauty as in like basic goodness. It's all artful. It's all beautiful. You're seeing all the time. So that's more of what they say. It's a process. It's a way of seeing, training the imagination to see symbols and beauty and everything.
Yeah.